పేపర్ లేకపోతే మా
Impetigo Manasa garu, Sandeep garu joined, huh?
Yes, sir.
Okay.
Shall we start, sir?
Sandeep garu?
Yes, sir.
Good morning, Andy.
Yeah, good morning, sir.
Thank you for accepting our invitation.
Thank you.
As a
Thank you so
resource
much for
person.
inviting me, sir.
Shall we start the session, Andy?
Yes, sir. Yes, sir. Sure.
Manasa garu, you can
Yes,
start.
sir. Good morning to the esteemed speaker, participants, Principal Dr. A. Lakshman Rao, sir. Myself, Manasa, Assistant Professor, Department of Pharmacology. On behalf of BV Institute of Pharmaceutical Sciences, excited to welcome you all to Day 5 of 1 week online faculty development program on cell therapy, pharmacological insights and future directions, organized by VV Institute of Pharmaceutical Sciences, Gutlavalleru. I welcome Pattern Dr. A. Lakshman Rao Garu, Professor and Principal of VV Institute of Pharmaceutical Sciences. Now, I would request Dr. A. Lakshman Rao sir to speak a few words about today's session.
Thank you, Manasa garu. Respected resource person of the today's session, Senior Academician, Dr. D. Sandeep garu, Associate Professor, Department of Pharmacology, Chebdul Hanamaya Institute of Pharmaceutical Sciences, Chodavadam, Guntur, Andhra Pradesh, participants from various pharmacy colleges. A wonderful morning to one and all for the fifth day of the 1 week online faculty development program on cell therapy, pharmaceutical insights and future directions, organized by VV Institute of Pharmaceutical Sciences, Gudlavalleru, from 9th to 14th December 2024. In day 5, Dr. D. Sandeep will deliver a lecture on living drugs, a cell-based therapy with insights on current and future pharmacological aspects. Just I'll give the brief outline about the today's session. Today's topic explores the evolving field of cell-based therapies, focusing on their potential to serve as living drugs for the treatment of various diseases. This lecture provides an overview of how cells, particularly immune cells, stem cells, and engineered cells, are being harnessed to treat conditions like cancer, autoimmune disorders, and genetic diseases. Current advancements in genetic manipulation and genetic engineering and delivery methods are discussed, along with changes such as immunogenicity and scalability and ethical concerns. Additionally, the future of cell-based therapies are examined, highlighting the promise of personalized medicine, improved safety profiles, and the integration of the novel technologies like CRISPR, CRISPR. The today's session emphasizes the importance of interdisciplinary research to fully realize the therapeutic potential of these living drugs. On behalf of management, principal, staff, and students, and let me thank Dr. D. Sandeep Garu for accepting our invitation as a resource person for this particular 1 week of online faculty development program. Thank you very much, sir. And now I hand over the session to Ms. G. Manasa, Assistant Professor and Convener for the Faculty Development Program, to introduce the today's speaker to the participants. Over to Manasa Garu.
Thank you, sir. We are very grateful for your words, sir. Thank you so much. It's my pleasure, immense pleasure to introduce today's esteemed speaker, Dr. Tappalapudi Sandeep sir. Born on August 12, 1989 in Guntur, Andhra Pradesh, Dr. Sandeep sir has had an extremely academic journey and he completed his graduation from Sri P. Ramireddy Memorial College of Pharmacy, Kadapa, and went on to earn his MPharmacy in Pharmacology from Raghavendra Institute of Pharmaceutical Education and Research, Anantapur. Dr. Sandeep sir received his PhD from Acharya Nagarjuna University, Guntur, Andhra Pradesh. With over 12 years of experience in the field of pharmacy as an educator, Dr. Sandeep sir has made significant contributions to research, publishing 42 research and review articles in reputed national and international journals, indexed in Scopus and Web of Science. His Accolades include the Best Oral Presentation Award at the 70th Indian Pharmaceutical Congress in New Delhi, a first place finish in e-poster presentation at the National Conference on Innovations in Pharmaceutical and Biological Sciences in 2020, and the Best Overall Academic Performance Award in 2022 and 2023. Dr. Sandeep sir has also guided 38 B Pharmacy and M Pharmacy and PharmD projects and holds H index of 6 with high 135 citations, and he has been granted 2 Indian patents and has participated in over 75 faculty development programs, workshops, seminars, and webinars. Additionally, Dr. Sandeep sir has served as a reviewer of prestigious Scopus and Web of Sciences and indexed journals, and as a resource person in various conferences and seminars. Currently, Dr. Sandeep sir is serving as an associate professor in the Department of Psychology and Pharmacology at Chebrolu Hanumaya Institute of Pharmaceutical Sciences, Guntur, Andhra Pradesh. Please join me in welcoming Dr. Sandeep sir. I will hand over the session with my respected to our resource person. Now I hand over the session, sir. Please accept.
Yeah, thank you, ma'am. Thank you so much for your kind words. And firstly, I would like to thank the management of VVIPS and Principal Dr. A. Lakshman Rao, sir, and convener of this 1 week online FDP program, Ms. G. Manasa Garu, and all the participants for welcoming me for this today's session. And without any delay, I'll just share my presentation. Is it visible, ma'am?
It is visible, Sandeep Kadu.
Okay,
Okay,
sir.
fine. Good and
Thank you, sir.
okay.
So firstly, I would like to welcome you all for this today's session of 1 week online FDP on pharmacology, that is cell therapy, pharmacological insights and future directions. And my topic is living drugs, cell-based therapy with insights on current and future pharmacological aspects. So as Sarah already said, I have been working as an associate professor in Department of Physiology and Pharmacology of Chebrolu Hanumaya Institute of Pharmaceutical Sciences. And now without any delay, just we will move on to the session. And first, we need to know what are living drugs. See, as the name itself suggests, living drugs means these are nothing but these are therapeutic inventions where the living cells or any of the genetically modified cells are used for specific diseases. That means if we want to treat any specific kind of disease, we can use these living drugs. So as the name itself suggests, we are using a living moiety over here. So here, what we can do is, we can take the cells, the living cells from the patient's own body, and we can again engineer them genetically. And after modifying, we can induce the same cells again to the same patient. That is one thing. Or if the cells are not available in the patient, then what we can do is we can go for a donor. So like similar to organ donation, so this living cells donation can also be done. So we can go for a donor and we can take the cells from donor and we can engineer them and we can again introduce for the therapy using these cells. So the basic example for this living drugs is, one is the CAR T cell therapy, which is the most popular one nowadays, and which is in most of the news, international news nowadays. This CAR T cell therapy, and I will explain later what is the CAR T cell therapy and everything. And the oldest example for this living drugs is leeches. We all know nowadays this leech therapy is also in higher models. That is like for removal of any impure blood or any blood purification process. Like that, we are using these leeches. So this is the oldest example. And moving on, how living drugs differ from the normal medicines. That means the conventional medicine, what we are taking in our daily life, like tablets, capsules, everything. And apart from this, how these living drugs will differ from that normal medicine. See, we all know the normal medicine, it is obtained from the chemicals or any of the chemical sources or any of the natural sources. Like we all know, we need to extract something or we need to take some chemicals, we need to mix it with some excipients and we need to make some medicines. And mostly those medicines will work to the molecular interactions like that. But here, the living drugs, they are basically working based upon the cells, which are isolated from the people, and those cells are used for therapy in case of specific disease conditions. That is one of the most prominent difference. Like It is not chemical based. It is completely based on living cells. And the second difference is, one, normal medicines, we can obtain it from the natural or any of the synthetic sources. And we could not focus on specific disease conditions. I mean, of course, we can go for the specific disease, but we know that the normal medicines have some of the differences, or they can be used for a wide range of things. And we could not focus on the specific disease conditions. But these living drugs, they are fully functional cells, and they will specifically target on a specific disease, like any sort of the cancers like that. And the another difference is, coming to this normal medicine, which are non-biological and conventional drugs, they will have some easily identifiable structures. We all know the normal chemicals or the normal medicine, they are made up of chemicals like some benzene rings will be there, some purine rings will be there, like that. So that can be done with the help of these normal medicines. But in case of these living drugs, we could not go for such chemical modifications. We will have only the cells, or we will have the known molecular based cells, or the T cells, or the viruses. Any of the normal things will be there, or any of the biological things will be there. So that is one of the thing. And another major difference is the route of delivery. So we know that normal or the chemical based drugs, they are delivered through various routes like IV, IM, oral, all these routes we can deliver them. But these living drugs, they can also be delivered through only specific routes like oral or any of the in vivo models. And coming to the challenges in developing the living drugs. So what are the basic challenges in developing the living drugs? See, as we are discussing these living drugs, these are the new ones in the market. So, of course, there are some challenges in developing of these new drugs. One of the most basic and common challenge in developing of this living drug is cost. See, as an Indian or as a people, what we focus on mainly is the cost. We all know the basic difference. If in the market one drug is highly cost, not all people can afford it. So only some people can afford it. So obviously, the major challenge in the developing of this living drug is cost, because we are talking about the genetic engineering or gene manipulation or modification over here, which leads to more cost, obviously more cost. So that is one of the prominent challenge. And second one is accessibility. That means it is not available easily in all the places. Like simply if you want to have one paracetamol, we can go to a medical shop and we can ask the pharmacist, okay, give me some paracetamol, and he will give us some drugs, paracetamol drugs. But like that, we could not go to some medical shops or some of the hospitals and we can say, okay, just give me some living drugs, I will take living drugs. So that is one of the major problem. The accessibility is limited. And the third one is safety. This is the most important concern, which we can, or all the people are concerned, the safety. So see, every drug or any of the chemical moiety, first we need to look for the safety. So here in living drugs also, there is some point of safety. I mean, we could not say it is 100% safe, but we have limited resources, or we have limited limitations regarding the safety of this. And next one is personalization. So this is one of the beneficial feature in case of these living drugs. And at the same time, it is the most challenging one in case of this personalization. Miss Lavanya, please mute yourself. Coming to this personalization. So this personalization is the one of the most prominent feature which we can see in this living drugs. That means if a person is having some issue or some genetical issue, we can use these living drugs and we can treat him based upon that. Or if the genes or any of the things will differ from other person, we can go for personalization with that also. So here personalization and hitting the target plays an important role. That is one of the challenge. We need to develop how the drug works into a specific person. And next one is compatibility. See, even though people are having the common diseases, like everyone will have cancer. For example, let us assume that 10 patients are having cancer. So we cannot say, okay, all the 10% will take this living drugs and all 10% will have equal effects. Because some drugs are compatible with some people and some drugs are not compatible with some people. So we can give an example for the food interactions over here. Like we all know that some people are safe to eat anything, but some people are limited to their food habits, because some people could not take leafy vegetables or brinjal like that. They will have some irritation. So compatibility is also one of the major challenge. And the most important one is ethics. We cannot ignore the ethics in case of these living drugs, because the people here, they will suffer. Obviously, they will suffer. So, in the process of treating, there are some ethical issues. We cannot take everyone into the consideration, or we cannot take every people and we can freely use these living drugs. We should follow the ethical concerns. Ethical issues are there. So, ethical concerns are needed to be explained to the subject first, and then we need to get the approval also. So these are all the challenges in developing these living drugs, but we can overcome these challenges with some simple techniques. So let us go through that one. So before moving on to that one, we will just see the applications of these living drugs. So coming to the applications of these living drugs, we can see the living drugs in case of these four conditions. The first and foremost and very, very, very important and useful one in case of this living drugs application is the cancer treatment. So we all know nowadays the cancer is the most common one. Like it is just coming to everyone like fever. So how the people are suffering from fever, just like that, everyone are getting or everyone are suffering with these cancers. So in case of this cancer treatment, these living drugs are highly beneficial. And recently, there is some news in the articles also. Uh, One person has completely cured from cancer with these living drugs, and that study was done in India itself. In India only, it was done. So mostly these living drugs or the development of these living drugs are highly focused on treatment of various types of cancers. So cancer therapy, it is highly, highly useful. And second one is genetic disorders. Like any people are having single gene mutations. I don't want to go deep regarding this genetic matters, but let me just explain in a short manner. So gene mutations. So we can know about the genetic mutations. Like when we are studying about the mutations, we are having single gene mutations, multiple gene mutations, or any of the duplications like that. Among that one, if you are changing any single gene genetic pattern, that means in case of A, you are keeping G, or in case of U, you are keeping C, like that. If there is any single gene mutations, it also leads to specific diseases. So for that treatment also, we can go for this usage of living drugs. And next one is in case of autoimmune disorders. So we all know autoimmune disorders are nothing but when a person own body cells will think their own body parts or any own body cells as a foreign particle and shows opposite effects against that particular part. That means the body's immune system will be activated and produces antibodies or kills that particular organ or cells. So some of the examples for these autoimmune disorders are like myasthenia gravis, like that. So these, in case of these autoimmune disorders, the patient will suffer in like a hell. So because mostly the immune system will be damaged over. So for this treatment also, we will go for the usage of these living drugs. And next one for the normal infectious diseases, like where we need to target a specific pathogens, or where we can go for the treatment of these dreadful diseases like HIV, we all know, HIV AIDS, or any of the sort of hepatitis like hepatitis A, B, C, or many of the sorts of hepatitis. So for all these conditions, for all these infectious diseases, we can also go for the usage of these living drugs. So mostly the living drugs are focused now only on cancer and some sort of autoimmune diseases, and very, very less part of genetic disorders. And rarely the study has been done on infectious diseases. And mostly people are focusing on cancer because it is a burning topic. So mostly people are focusing on cancer treatment only by using these living drugs. And let us see how these living drugs work. See, living drugs, although they function through various mechanisms, but mostly they will target the immune system. So it will work upon the immunotherapy principle. That means, for example, if you want to modify any of our immune cells, first we will take that immune cells out from the patient. So let us consider this as a patient. And here, based upon the condition of the patient, they will take the immune cells out of the patient and they will change some mean, they will do some modifications on these living cells. Like mostly the immune cells will be taken, like T cells, B cells, any of the cells will be taken. And after performing some genetic modifications, again they will introduce these cells into the patient. So by this, of course, it is a cyclic process. In this cyclic process, the living drugs play a major role. Okay. So this is the basic principle. So let me explain how these things will work. And the current approaches for this living drugs is, the most prominent one is CAR T cell therapy. So we all know T cells and B cells. So T cells and B cells, nothing but these are the lymphocytes. So these are the lymphatic cells or the immune cells, like T cells and B cells, T lymphocytes and B lymphocytes. They play a major role in the body's immune response. Like whenever a foreign substance is entering into our body, these T cells will activate our immune system and they will fight against that antigen which enters into our body. So this may be through activation of lymphocytes, other lymphocytes, B lymphocytes, or any of the immune cells in our body, or it may be through any of the signaling mechanisms. So among these, the T cell plays a very important role. So the scientists have taken that T cell and they have gone for this CAR T cell therapy. So what is this CAR? CAR means chimeric antigen receptor. So what do you mean by chimera? Chimera means it is one of the Latin term or the Greek term, which indicates a combination of 2 to 3 different genes. So chimera means a combination. Okay. So here what we will do, what they will do is, they will take some 2 to 3 different moieties or two to three different types of signaling genes, and they will combine. They will combine and they will form an antigen receptor based CAR T cell. Okay. So let me explain with this is a simple diagram. So these CAR T cell therapies, they do not work on immune checkpoint inhibitors. Let me deviate a bit from this one. So we all know during the process of cell cycle, we all know that there is a process of cell cycle through which the cells will divide, like G0 phase, G1 phase, S phase, G2 phase, M phase, all these phases. So mostly cancer therapy was done by inhibiting this process of cell cycle. For this, we are having 2 checkpoints. Checkpoint 1 between G1 and S phase. Checkpoint 2 between G2 and M phase. Most of the cancer treatments will focus on these checkpoints where the cell division will be stopped. Okay, the cell cycle will be stopped. So we all know cancer means continuous multiplication of the cells. So if we stop the process of cell division by using this checkpoint inhibitors, we can stop the cancer. But even though that technique is there, it is not acceptable or it does not work properly in most of the patients. So for that reason, they have taken this CAR T cell therapy. And this CAR T cell therapy, it does not work on the checkpoint inhibition, but it is highly having the capability to completely eradicate any of the advanced leukemias and any of the advanced lymphomas. So here I'm focusing on this advanced term. That means even if the cancer is in the phase 3 or phase 4, they can also go for this CAR T cell therapy. So it has shown beneficial effects even in the later stages or the last stages of the cancer also. So how it works? See, let us see that this is a general cell and this is one of the CAR T cell. Like this is a CAR T cell. For example, consider this as signaling moiety and this is the outcome receptor. Okay, this is the antigen recognition domain. So we know receptor have multiple domains. So the outside part, it is called as antigen recognition domain, which recognizes the antigen that is present in our body and activates the immune system. So here we have 3 different generations of this considered thing. In the first generation, simply we all know we are having one antigen recognition domain, and in the inside of the cell we are having a signaling domain. Okay, it is a simple mechanism. Whenever the antigen comes and binds to this place, just the signal will evoke and the body immune system will be activated. And coming to second generation, instead of one signaling mechanism, the body has adopted to show response with the help of 2 signaling mechanisms. That is the multiple signaling mechanisms. And in case of third generation, that is the advanced thing which we are talking now, that is the CAR T cell based therapy, they have taken multiple signaling mechanisms. That is double 2 signaling and 1 single signal. So because of this, what happens is the immune system will be quickly activated. So because of increased domains, the immune system will be easily activated. That is one advantage. Second one is it can survive longer in case of circulation. In body circulation, whenever we are inducing these CAR T cells, there won't be easily damageable structure for this one, and the cells will survive for a very longer period. That is one of the advantage. And the third one is it is having the ability to produce the more and more amount of T cells. That means this induction of CAR T cells, it causes more and more activation of the immune system. That is one of the advantage. Okay. So let me summarize this for you. The one is the cells will survive for a longer duration of action, and the second one is the more activation of immune system, and the third one is stability of these cells. So these three are the beneficiary factors for this CAR T cell. And coming to this CAR T cell therapy and how it works. So currently, this CAR T cell therapy is working as a customized process. That means it is designed for each and every individual in a separate manner. For me, if I am having cancer, this CAR T cell therapy, it works on a my basis. If another person is having cancer, and they can be treated by using this CAR T cell therapy in their manner. That means mostly the customization was done. So this is one of the prominent feature in this CAR T cell therapy. And how it was done. See, first, what they have to do is they need to collect the T cells from the patient. In which patient they want to treat the condition. First, from that patient, we need to collect the T cells. So let me see the processing here over there. Just follow these numbers. Firstly, we need to remove the blood from the patient to get these T cells. Consider this as a T cell. Okay. And after extracting the T cells, then we need to re-engineer that T cells by inserting a CAR gene. That is chimeric antigen receptor producing genes. So these genes, they can be inserted by using vectors. So let me introduce this term vectors. So vectors are nothing but these are the carriers inside the cell. See, we are talking about a molecular-based therapy over here. So in that molecular-based therapy, we need to use the carriers which will carry our genes inside the cell. Okay. So when we want to do such therapies, we need to go for the vectors which can easily enter into our cell. Like the specific example, viruses. Okay, we all know we will easily get virus infections. Why? Because the virus can easily enter into our body cells and it can alter our genes. So here we can use the viral vectors. So now you may be having a doubt that, sir, if we are using viral vectors, then we can get viral infections from that virus. Just let me confirm you over here. The viruses which we will use for this CAR T cell therapy, they will have the virulence property, but not the disease-causing property. That means they are having the division property, but they do not have any of the disease-causing property. Only we will use the integration part, or we will use the incorporation of this viral vectors into the genes. Okay. So like that, we will introduce that viral genes into this CAR cells. And after inserting, we will wait for this production of CAR proteins. That is the chimeric antigen receptors on the surface of T cells. So here, just observe briefly. So here, CAR cells, normal T cells are there. But here, after introducing this CAR T genes into this, the CAR T cell will be produced. That means on the surface of this T cells, we will have CAR proteins. So this is the structure of a CAR protein. So it will have a stalk and a head. So this is the head and this is the stalk. So these are the CAR receptors, that is chimeric antigen receptors. And after successfully producing and after successfully having the reproducing capability of these CAR T cells, we will grow these CAR T cells in a millions of manner in the laboratories. And after growing these millions of CAR T cells, we will infuse that CAR T cells into the patient from whom we have taken these T cells. Okay. After growing, we will infuse them to the patient. Now, after entering of these CAR T cells into the patient, what happens is they will target a specific disease. Like if we are focusing on the cancer, like let me give an example, leukemia, that is the white blood cell cancer, for example, let us consider. Now, what this CAR T cell will do is, this CAR T cell will go and attach to the cancer cells which are present in the patient, and it will show binding to the cancer cells, and it will kill the cancer cells specifically. So how it was done means, with the help of this CAR T genes, where we on the surface of these CAR cells, on the surface of these T cells, we are having this CAR protein, and this CAR protein will specifically bind to the cancer cells and it will kill the cancer cells. Okay, so this is the basic process of this CAR T cell therapy, which is very, very, very simple. But of course, what I have discussed, the challenges. The challenges we need to think about this. Okay, so let me summarize this for you. First, we need to remove the blood from the patient to get the T cells. And after extracting the T cells, then we need to genetically modify that T cells by using the CAR genes. That is the chimeric antigen receptor producing genes. We will insert it into the T cells by using vectors. So here the vectors may be viral vectors or non-viral vectors. And let me tell you the difference. If we are using viral vectors, there will be 90% of the chance that the virus will successfully carry the genes into the cells, and there is a production of CAR T cells. But if we are using a non-viral vectors, there is some problem. That means only there will be some around 50 chances, 50-50 chances of getting a CAR T cells. That's why we will mostly use the viral vectors. And after entering of this CAR gene into the T cells, now CAR T cells will be produced. That is, the T cells will have the CAR protein on its surface. And after reproducibility, that is, after repetitively producing it, and after getting a successful strain of CAR T cells, we will grow those CAR T cells in the laboratory itself. And after having a millions of those CAR T cells, we will introduce those CAR T cells back into the patient who is suffering from the disease. And after entering of these CAR T cells into the person, those CAR T cells will specifically target the type of the cancer cells which we have re-engineered, and will kill those cancer cells. Okay, so success rate is now, in some patients it is around 60 to 70%. In some patients it is around 90%. In rare conditions it is 100%. That means there will be no cancer. That means the cancer will be treated completely in those patients. And we all know this FDA, Food and Drug Administration, it has approved this CAR T cell therapy also. So till now, only 6 drugs have been in the market for this CAR T cell therapy. And all of these drugs, they have used for the treatment of blood cancers, various types of blood cancers, like any of the lymphomas or any leukemias, or most recently, it is also used for the treatment of multiple myelomas. Like, let me give some examples for this one. Like tisagenlecleucel and axicabtagene and brexucabtagene and lisocabtagene and idicabtagene and ciltacabtagene. So all these are the generic drugs which the scientists have developed for using this CAR T cell therapy, and mostly they are focused on CD19 receptors. So we all know that the CD9 target antigens, CD19 antigens, these are present over the cancer cells, and the CD19 and CD25, CD24, many categories of the receptor-based receptor target antigens are there in our body, and mostly the CD19 has been targeted. Why? Because it is completely related to this lymphomas or leukemias. And all these agents, they are used in case of adults and also in children. In both the conditions, they have used this CAR T cell therapy. And let me remind you, here they have taken the children, they have taken the young adults, and they have taken the adults who are having cancer in initial stages, that is in stage 1, stage 2, and at the same time who are having a relapsed conditions of cancers. That means once they are having cancer, after the treatment, the cancer has been subsided, but again after some time, again there is relapse of a cancer. That means again the cancer has been occurred, or the cancer has been started in them, or any of the disease conditions. In all these patients, they have successfully tested this CAR T cell therapy, and they have found 70 to 83% of the results in treatment of this CAR T cell therapy. That is one of the advantage of these drugs. And of all these 6 drugs, the most popular one and the mostly used and the mostly heard name is axicabtagene. This is the mostly used CAR T cell based drug, axicabtagene ciloleucel, which was sold under the brand name of Escarta. that is majorly useful for the B-cell non-Hodgkin lymphoma and follicular lymphoma conditions in case of adults mostly. Okay. So these are some of the FDA-approved CAR T-cell therapies. And now we will move on to the side effects of these CAR T-cell therapies. So what are these CAR T-cell therapy side effects? See, you may see most of the side effects for this CAR T-cell therapy. Majorly, it affects our immune system, the first thing. And the second one is it affects our neurological system. So I will just move on to the side effects and I will just focus how these can also be reduced. Now, in current developments or in the current scenario, these side effects also have been reduced. So first, let us discuss what are these side effects, then we will move on to that thing. So we all know, as it is an immune-based therapy, the first thing is we can observe a decreased antibody producing cells. So the B cells, which are present in our body, apart from the T cells, they will generally produce the antibodies in our body. But when we are under this CAR T cell therapy, there is a decreased antibody producing capability for these B cells. That is one problem. So as we all know, as there is a decrease in this B cell production, obviously there will be higher risk of infections. Okay. And another thing is the cytokine releasing syndrome, CRS. See, we all know cytokines, which are nothing but the inflammatory mediators or the immune system mediators. So what our body will think is, as there is a more number of T cells, the T cells proliferation or the T cell count will increase, which activates the other immune cells like cytokines. So this causes release of more cytokines into our blood. And that condition is called as CRS, that is nothing but cytokine release syndrome. So what we will observe in case of the CRS? See, in case of CRS, that is cytokine releasing syndrome, we will observe symptoms like high fever, sudden drop in blood pressure, and some sort of delirium. That is a state of confusion. So these are observed in case of the cytokine releasing syndrome. And apart from this, if the cell therapy has affected your neurological symptoms, that is, in case if it has affected your brain, then you can observe ICANS syndrome, that is immune cell associated neurotoxicity syndrome, where the symptoms like impaired speech or any of the dizziness or seizures or loss of body balance can be observed because your brain has been affected. That obviously affects your speech. You could not speak properly. Or any of the seizures, that means like fits can be observed. Or any of the body balance can be lost. And apart from this, two conditions, that is ICANS and CRS, another side effects include fast heartbeat. Sometimes you can also observe fast heartbeat. The patient will experience some laziness or any of the muscle or joint pains, and very common side effects like nausea and vomiting. And very rare conditions, the breathing problem will be observed in case of patients. And in some people, allergic reactions have been developed because especially when we are having the therapy by using the cells obtained from the foreign particles. That means the cells are not taken from the patient. If the cells are taken from other patient, from the donors, as the cells are not their own, in rare conditions, allergic reactions may be developed. And next one, in some people, you can also observe these abnormal mineral levels, like sodium levels, potassium levels, magnesium levels. They can be decreased in case of this CAR T cell therapy. Okay. So these are all the side effects of this CAR T cell therapy. So now you may having a doubt, sir, you have dealt with a lot of side effects regarding this CAR T cell therapy. Then what is the use of this CAR T cell therapy, or why we should use this CAR T cell therapy if you are having these many side effects? So we are having a solution for this side effects. That is the India-based CAR T cell therapy, which has approved recently in 2023. So in India, the CDSCO has approved this first CAR T cell based therapy, which was sold under the brand name NextCAR19, which is a very, very groundbreaking immunotherapy that has been developed by a company called ImmunoAct. This company, in association with Indian Institute of Technology, IIT Bombay, along with Tata Memorial Hospital, it has developed in 2023. Sorry, it has developed a CAR T cell therapy, and it got approval in 2023 from the CDSCO, that is Central Drug Standard Control Organization, regarding this one. And sorry. And this therapy, it is majorly designed to treat leukemia and any of the refractory or relapsed lymphoma conditions. So where the cancers of the lymph system or lymphatic nodes has been mostly observed. Okay. So now let me explain this next car. So this next car, it was developed by this company called ImmunoACT. So which is the company that is associated with the IIT Bombay and Tata Memorial Hospital. So what they have done is, so they have designed a therapy to treat this leukemia condition and refractory or relapsed lymphoma, that is mostly the cancer affecting the lymph system. So what they have done is they have created a immuno CAR T cell therapy based upon the CAR T cells which was developed in the US. So in case of US or UK, we have seen all these side effects like ICANS or any of the CRS syndromes or any other side effects. So what they have ImmunoAct have focused is they want to reduce those side effects, which has observed through this CAR T cell therapy. So what they have done is they have studied all these side effects and they have done some modifications in this CAR T cell therapy where they can easily reduce those side effects. So we will discuss the advantages of this NextCAR19. So this NextCAR19, we know in general, the CAR T cell therapy is highly expensive. That is, in case of US or UK, it costs around $400,000. That is 4 lakhs US dollars, which is very, very, very high. The normal people can't even afford or can't even think of that. Even the rich people also could not think of this therapy. But this NextCAR19, which is having a drug of actylcaptogene autoleucel, they have offered this CAR T cell therapy. They have reduced the cost of this therapy. They have lowered this cost up to 30 to 40 lakhs. Even this 30 to 40 lakhs is also very, very high for us. But when compared to the $400,000, it is very, very less. Okay. Generally, you can easily convert that $400,000 into our Indian rupees means it will cost around some 28 crores like that. So apart from this 2 crores or 28 crores, if this 30 to 40 lakhs is very, very less. So they have brought down the cost. That is one of the advantage. And second one is, even if the patients who are in the phase 1 and phase 2 trials, so we all know for the development of a drug, we need to pass through four phases of drug trials: phase 1, phase 2, phase 3, and phase 4. Even in the starting of phase 1 and phase 2 trials only, nearly 70% of the overall response rate for this NextCAR19 has been observed, which is very, very beneficial. And for this approval or for this CSEO approval, in the data they have submitted, they have shown 100% therapy in a single patient, in one boy, in one child. He's suffering from actually the lung cancer. He's actually suffering from the lymphatic cancer. Using this NextCAR19, he is 100% treated. That is one of the advantage of this NextCAR19 they have shown. And the other advantage for this NextCAR19 is the improved safety profile. So mostly the high safety or the side effects which we have discussed earlier, they have completely reduced by using this NextCAR19, particularly in case of the CRS syndrome. So let me remind you, this CRS syndrome, which is having the symptoms like high fever, sudden drop in blood pressure, or delirium like that. So all these conditions have been highly reduced or highly cleared off by using this NextCAR19. And another advantage is absence of neurotoxicity. That is this ICANS condition. So this ICANS condition or CRS conditions has also been completely reduced by using this NextCAR19. So we are very proud of our India-based company, which is the ImmunoAct, for developing this NextCAR19 for the treatment of cancers using this CAR T cell therapy. So let me summarize this for you. The advantages: one is they have brought down the cost. Second one is the overall response rate is very high. And the third one is safety profile by reducing the ADRs related to cytokines as well as the reduction in neurotoxicity. So this is done with the help of this NextCAR19. And coming to the future challenges of this living drug therapy. So what are these future challenges? So what we need to focus? See, till now we have seen only to the cancers that are pertain to blood or any of the lymphatic tissues like that only. But we haven't discussed about the solid tumors. See, let me remind you, the tumors are divided into different types. And one of the thing is solid tumors. Solid tumors are nothing but these are the tumors which we can observe in case of solid parts or the solid organs in our body, like brain, breast, kidneys. These are the solid parts. So for these solid parts, still there is a need to develop this living drug therapy. Of course, there is some progress or the work going on for this living drug therapy in the treatment of solid tumors, but the success rate is very, very less. Only 10 to 20% of the success rate has been observed till now in case of the solid tumors for this brain, breast, or kidney tumors condition by using this living drug therapy. So scientists are mostly focusing on this solid tumor treatment because mostly people are suffering from breast cancers or ovarian cancers or kidney cancers like that. So the area is going on that one. So we need to focus more on that one. And the second one is we should also overcome the tumor heterogeneity. So let me explain you what is this tumor heterogeneity. So for example, let me consider if you are having a tumor inside your body, like for example, if you are having a brain cancer and I am also having brain cancer. So we both are having brain cancer, both is same. But that tumor inside your brain, it will act differently. And the tumor in my brain, it will act differently. Why? Because the genes inside you for causing tumor and the genes inside me for causing tumor will have slight variation. The basic gene will be same, but the other parts, the introns and the exon part may be slightly different. So because of this difference, the drug therapy will be different for you and for me. That's why because to overcome this tumor heterogeneity, we have developed this CAR T cell therapy, which is majorly focusing on individual basis, that is customization. Now, this CAR T cell therapy or this living drug therapy is mainly focusing on this tumor heterogeneity, that is individualization or customization. So this customization is a bit tough part because you need to be completely studied first. Your genetics should be completely studied first. And after studying about your genetics, then we need to focus on your genes and how you can be treated and what are the modifications that are needed to be done on you. So that thing should be overcome. And next one is should aim to develop the off-the-shelf CAR T cell therapy. So this is one of the term. Of course, some of you have been heard about this term, off-the-shelf. So off-the-shelf means where it can be easily available or it can be easily accessible to people. So till now, this CAR T cell therapy has only limited to certain institutions in US and UK. I mean, the people where they are mostly focusing on this one, like cancer institutes or mostly the companies. And the second one is in case of the startup products or some companies who are basically working on this one, like ImmunoAct or some other companies, Indian companies, only they are having this CAR T cell therapy. So not all people can go to that companies or can go to US or UK for taking this therapy. So for this thing, what we need to do is we need to bring that CAR T cell therapy to off the shelf. Off the shelf means we need to select some of the centers where the people can easily access this. Just like where we can get the TB drugs or where we can get the anti-HIV drugs. So we can go for a particular location or an ART center or we can or a TB center. We can go there and we can get the drugs. Like that, simply, we also need to have some off-the-shelf centers where we can get this CAR T cell therapies that can be easily accessible to all the people. And next one is introduction to technologies like CRISPR to produce this CAR T cell therapies. So as Lakshman Rao sir has said in the introduction, we need to focus on the CRISPR therapies. So CRISPR gene, which is the mostly talking gene now. So as the name itself indicates, CRISP, that means short. Okay. So this CRISPR technology, it is a gene-based therapy where we can use this CRISPR genes to cut short the disease conditions or to cut short the genes that are responsible for the disease treatment. And we can use or we can combine the genes for the production of the drugs or the production of these CAR T cells or the chimeric antigen receptors. So we all know CRISPR protein is majorly useful nowadays for the gene therapy, especially for in vivo gene therapy, where it is mostly useful for the treatment of the autoimmune disorders. And the CRISPR therapy is also now focusing on the in vitro gene therapy for the production of most of the immunological agents like antibodies for specific conditions or for development of genetically modified substances. So similarly here also, we can go for the usage of these CRISPR genes where it can be used for cutting of the chimeric genes or for the cutting of the required genes to produce this CAR, okay, for producing this chimeric antigen receptor. So by using this chimeric antigen receptor, we can produce more number of beneficial CAR T cells. And another challenge for this living drug therapy is we need to reduce the side effects. Even though the Indian-based drug has reduced the two conditions, that is the neurological effects, and the other one is immune responses, still some other side effects like generalized side effects are there. They also needed to be reduced for this effective drug therapy. See, because if we are having, if we are generally, what will be the human nature is when we are spending too much of money on a specific drug or on a specific treatment, what people will expect? The people will expect to have minimal side effects or minimal effect on them. That means minimal adverse effects should be there on them. If we are having more adverse effects, if we are using, if we are keeping or if we are dumping our full money on particular drugs or particular diseases, then there will be no use for that for such kind of treatments. So for that thing, what we need to do is we need to reduce the side effects. For that also, there is some research going on. So for this thing, what they are doing is they are doing some modifications by using this CRISPR technology and another technology called as TICAN, TICAN, that is TICAN technology is also there. So where they are using some techniques through which the side effect producing genes are also going to be trimmed. So if any people are dealing with this biotechnology things, they will get this topic. After creating a genes, we need to cut the unimportant parts, and that technique is called as trimming mechanism. So which is nothing but the post-genetic techniques. So by using these trimming technologies, we need to cut that particular part which is responsible for production of the ADRs. So by removing such products and by improving the stability of these CAR T cell therapies, we can reduce the side effects. And lastly, the most important and the challenging topic and the challenging thing in this drug therapy is cost cutting. See, as I have previously discussed, of course, it is a new technology. And of course, when we use a living drug, we need to go for three things. One is cost. Second one is stability. Third one is effectivity. And the first problem is cost. See, as we are taking a living cell, we are keeping a living cell or we are taking a living cell outside the body. We are keeping it in a laboratory condition and we want to keep it stable for a very longer period of time. And again, we need to use that living cell inside a patient and we are expecting to get more effect. That means from a single cell, we are expecting too much. Okay, we are not expecting even 50% also. We are expecting 500% from a single cell. So when we are expecting that much of the thing from a single cell, we need to also spend some amount of money. So that amount of money in the initial stages, of course, in the developing stages, it will be very high. But once we crack the technique of easily developing the drugs by using this technique, we can improve the scaling or we can bring the scale up process in this one. And after bringing the scale up process, we can reduce the cost. Like for example, let me tell you an example for this one. For diabetes, let us consider for diabetes. So in case of diabetes, if we are taking a drug, like for example, if you are taking a tablet like glibenclamide or glucoside like that, if you are taking a tablet, so tablet costs around 100 rupees like that. Just I am telling for an example, a sheet costs 100 rupees. So after that, what people have done by taking that gliclazide or glibenclamide or glimepiride like the drugs also, there will be some imbalance in the blood sugar levels or blood glucose levels. For that, what they have done, we have developed a insulin. Okay, human mixed like that, human insulin mixed products we have done. and that thing, it will be costly. So it is costing around 440 or 450 rupees like that now. So when compared to 100 rupees tablet, this 450 is working better. So people want effect, and they need to spend more amount on this 450 rupees insulin apart from this glibenclamide. I'm not telling that people should shift to this costing thing, but people who would not afford, they have option of tablet. People who can afford, they have an option of insulin. Okay. So similarly, here also in case of CAR T cell therapy or living drug therapy, cost cutting issues are now going on. The people are majorly focusing on the cost cutting, and they want to reduce the cost, and they want to bring the 20 lakhs to 30 lakhs to 2 to 3 lakhs. So because some people, they can afford this 2 to 3 lakhs therapy, because we can know nowadays one knee replacement or surgeries or one open heart surgeries, they are costing 2 to 3 lakhs. So if they can spend that much in a heart or for a joint, why not they could not spend for a dreadful disease like cancer? Okay. So cancer, if I am saying that the cancer can be treated or cancer can be completely eradicated by using 2 to 3 lakhs, no, anyone, like some millions of people who are suffering from cancer, they can easily go for the treatment of by using these living drugs. Okay. So now the studies are going on for this cost cutting matter. And another challenge which I forgot to mention here is the scalability and effectiveness. The effectiveness, as I have mentioned, now 83% of effect has been observed in most of the patients. And of course, some people, this CAR T cell therapy is very, very less. It is showing less effect. But that is in very, very few people. Only 10 to 15% it is showing less effect. And even deaths also occurred in some people. That's why ethics came into consideration. And in very few people also, 99% of the complete remission of the cancer has been done. That means complete treatment or complete curing of the cancer can be done by using this CAR T cell therapy. Okay. These are all the future challenges for this CAR T cell therapy. And finally, I want to conclude that by using this CAR T cell therapy or the living drugs therapy, definitely it is going to be talk of the town or talk of the globe. Of course, it has been the talk of the globe in 2023 October, when the India has developed this CAR T cell therapy, which has shown 100% cancer eradication in a patient. Still, there is some issues in this CAR T cell therapy, like safety concern is there, cost concern is the major thing, and heterogeneity is one of the problem, and side effects has been one of the problem. Of course, the scientist has been developing some things to reduce these conditions, and all these conditions hope in near future it will be reduced, and soon this CAR T cell therapy is easily available for us for the treatment of the cancers. So that's it for the session. And just I want to go through once again what we have discussed. So first we have discussed regarding the living drugs. So we all know they are genetically modified cells for the treatment of the diseases like CAR T cell therapy, and how they will differ in case of normal medicines. Like normal medicines will have molecules, and here we are having living drugs, and they can be obtained from natural or synthetic sources, and these living cells can be obtained completely from the living organism. And there, in case of normal medicine, we know the structure and we know the condition over here, and the route of drug delivery has been deferred. And these are the challenges like cost, accessibility, safety, all these will be the concerns. And these are majorly used in the treatment of cancer, genetic diseases, autoimmune disorders, and infectious diseases. And how they are working means, first we need to isolate the cells from the patient, and then we need to make some genetic modifications by using CAR, that is the chimeric antigen receptors. We need to induce that thing, and then after inducing them in the laboratory, we will again we will grow them, and again we will insert the same thing to the same patient. And after entering the CAR T cells into the body, they will specifically target on the cancer cells, and they will kill the cancer cells. And these are the 6 drugs which have been approved by FDA for the treatment of this one. And till now, oxycaptogene is highly popular for the treatment of these cancers. And these are all the side effects. Mostly the brain will be affected, and our immune system will be affected, which can be treated or by using this Indian-based CAR T cell therapy, which was NextCar19, that was developed by the ImmunoACT company. And this is having an advantage of cost cutting. So the cost has been reduced drastically, and most effect was observed over here. And it also reduced the adverse effects that were produced with normal CAR T cell therapies. And these are the future challenges. That means we need to develop CAR T cell therapy which is safe, with less side effects and less cost. So thank you. And these are some of the references for this one. And finally, I want to thank, and I am open for the any of the Q&A sessions. If the participants are having any questions, you can please ask. Any doubts from participants?
Sir, they posted on the chat box, sir.
Okay. Is any evidence of CAR T cell therapy being effective for cancers other than lymphoma and leukemia? Yes, there is some evidence. Apart from this lymphoma and leukemias, they are also starting this CAR T cell therapy for the treatment of the solid tumors also. But as I have said, only 10 to 20% of the success rate has been observed in the treatment of this CAR T cell. In the usage of this CAR T cell for the treatment of solid tumors. That means the kidney tumors. And let me remind you, this CAR T cell therapy has also shown effect in case of lung cancers. That study has also been done. 80% effect has been observed, or 80% treatment remission has been observed in case of this CAR T cell therapy for lung cancers. That study has been done, and it was also under the approval process. How this CAR T cell therapy can help in chronic myeloid leukemia. Yeah. So as I have said this, as I have discussed earlier, ma'am. So this leukemia condition, or in case of this chronic conditions, here what we are doing is, after inducing the CAR T cells into the body, we will expect, or we are expecting, the longer duration. That is the longer duration of stay of these CAR T cells in the body. That is one of the advantage. As this is a genetically modified or the genetically engineered one, there, by using these CAR genes, we can see, or we can induce the long-term effect. The long-term effect has been observed, and that is also proven. In case of this chronic myeloid leukemia also, the studies have been done for the treatment of this chronic myeloid leukemia by using this CAR T cell therapy. They have observed the long-term duration or the long-term effect also. So it was also easily treated by using this CAR T cell therapy. Yes, any other queries? The Yeah, after giving CAR T cell, the therapy is working or not? Yeah, see. So after this therapy, what we can do is, the people, if for example, let me see about this leukemia condition. So after this, giving this CAR T cell therapy, it will work fastly, because we know the immune cells will work in a faster, very, very faster manner. So this T cell growth will be very high, T cell growth will be very fast. And after giving this therapy to the people, what we can do is we can go for the diagnosis. That is, one is we need to evaluate the T cell count. Whether the T cell count is increasing or not, we can check it. And the second one is we can go for the checking of this leukemia or this blood cell count. Simply, we can go for the blood cell count, and we can also go for the histopathological studies, where this lymphoma or this leukemia or this blood cell shape or anything we can easily check. And after checking that, we can easily know whether the therapy is beneficial or not. And this can be done within 2 days of treatment also. Within 2 days only, this CAR T cell therapy can easily show the effects. The effects can be started within 2 days itself. CAR T cell therapy have effect the immune system of the patient? Yes, of course, CAR T cell therapy will have effect on the immune system because CAR T cell therapy after entering into the body, what it does means one thing, it increases your immune boost. It boosts your immune system. It increases the T cell count because this CAR T cell, it is genetically modified one. After entering into your body, that millions of cells, they will modify your immune system or they will activate your immune system because alone CAR T cell therapy, it can show, of course, 90 to 95% of the effect, but it also needs some support from your body immune system. So it improves your T cell, normal T cell count, and in some cases, it also increases your B cell count. So that can also be increased. And one more effect is it also increases your cytokine release factors. That is also one of the increase in immune system. That thing can also be observed over here. Yes, any other queries? Yeah. Modification of natural immune system will be a disadvantage. Yeah, that is the issue which I have mentioned in my presentation. So that is one of the modification of immune system. That is one of the disadvantage which we can observe over here. But that thing that ICANS, that is the CRS problem. That problem has been reduced by using this Nexcar. This Nexcar, what it is doing means it is activating the immune system, but it is activating the immune system only up to the level which we want, not in an advanced manner. So that will be an advantage by using this Nexcar 90. Yes, sir. How much time we need to develop CAR T cells in immune cells in lab, sir? Yeah. So this is one of the challenge also, sir. If we are taking the genes from the patient itself, for example, if a person is suffering from a cancer, specific cancer, if we are isolating the cells from that particular patient, that will be easy, sir. First, what we need to do is we need to see whether the T cells are healthy or not from the patient. And after seeing that, then we can go for the incorporation of this CAR gene. And after CAR gene production and after the incorporation of this CAR gene, then we need to develop the CAR T cells. And next, we need to go for the multiplication of these CAR cells. So this whole process, if your gene is responding properly, you can do it within a span of 1 month also. Within a 1 month also, we can do it easily. But the issue is you need to see the reproducibility. The incorporation is very easy, sir. The incorporation of CAR gene is very, very easy into your cells. But the problem occurs with reproducibility. That means when you are supplying for the, or when you are subjecting the CAR cells, CAR T cells for the division, that should divide in a rapid manner, or that reproducibility should be in a rapid manner. So that takes some time. So mostly the lowest time period till now is 1 month, and the maximum time period is 4 to 5 months. Even after 5 months, if we can't develop that condition means, then they will just stop the study, sir. Yes, any other queries from the participants? Stem cell therapy or CAR T cell therapy, which one is best? Okay, sir. So here we need to talk about the specific disease, sir. If we want to focus on a specific cancer, okay, like leukemia or lymphoma, or we want to go for any specific therapy, then we can definitely go for CAR T cell. If we are not discussing in a proper manner, I mean, like if we are not having any specific therapy, then we can go for stem cell therapy. But the problem or the issue is the stem cells. The stem cell therapy, it takes even much more longer periods. And the success rate in stem cell therapy is also a bit less. And we cannot go for the individuality. The individual stem cell therapy is also a bit less. And it is expensive. Of course, CAR T cell therapy is also expensive. And stem cell therapy is having more disadvantages when compared to CAR T cell therapy. So that's why, in comparison with this stem cell therapy or CAR T cell therapy, if we are focusing on cancer, we need to go for CAR T cell therapy. Or if we are focusing on any other disease, we need to go for stem cell therapy. But my suggestion is CAR T cell therapy is better when compared to stem cell therapy. Yes, sir. Thank you. Any other queries from the participants? Okay, Mansa ma'am, can we
Yes,
close
sir.
the session?
Yes, sir. Thank you, sir. Thank you so
Okay,
much, sir.
okay. So thank you so much for the. Once again, I want to thank the management of VVIPS College and Principal Sir Dr. A. Lakshman Rao Sir, and the convener of this FDP, G. Manasa ma'am, and all the participants who have been patiently listening to my presentation for this 1 hour and so. And I want to thank everyone for giving me this opportunity, sir. I especially want to thank Lakshman Rao sir for giving me this opportunity. So thank you, sir. Thank you so much.
Thank you, sir. Thank you very much, sir. We learned a lot from your presentation, sir.
Thank you. Thank you so
Th-
much.
Thank you so much, sir. Sir, for your valuable time, we are giving a appreciation certificate, sir.
Okay, thank you.
I'll share it, sir. 2 seconds.
Yeah, sure. Sure. Thank you.
Sir, is that visible, sir?
Yeah, it is visible.
Yes. Yes, sir.
Thank you. Thank you so much, ma'am.
You're welcome, sir. Thank you very much, sir.
Thank you. Lakshman Rao, sir?
No, sir is not there.
Okay, okay. So shall we close the session, ma'am?
Yes, sir.
Okay, okay, okay.
Thank
Thank
you,
you.
sir. Thank you very much, sir. And all the participants, I'll post the link on chat box. Will you give me your responses by today evening? Thank you.